Wilbarger Protocol and sensory issues. Wilbarger brushing is an important OT technique that a parent should do to their child with sensory issues. Parents can do this at home for their child as a part of OT. Even if you cannot do other OT activities, brushing protocol is something you can do for your child to help them deal with their sensory issues. Benefits of brushing. Brushing improves focus, the ability to handle new situations, self-awareness, self-organization, and self-control. A Wilbarger brush looks like this. You will get this in Amazon. We rub this brush across the skin on hands, legs, and back in a specific manner described by the OT therapist. By rubbing the brush across the skin, the pressure input targets touch receptors and helps the child organize his or her central nervous system. This can calm down any overactive receptors that are misfiring and help bring a child's level of alertness to a normal calm level. Brushing can help children who have sensory seeking behaviors and who engage in unsafe or undesired behaviors. Brushing can help children who are slow at doing things or who are overly cautious about something. Some sensory issues that child exhibits and that can be dealt with brushing are screaming if their faces get wet, throwing tantrums when you try to get them dressed, having an unusually high or low pain limit, crashing into walls and even people, putting inedible things, including rocks and paint, into their mouths. First, understand how your five senses work with your brain. Your brain collects information like smells and sounds through your five senses: sight, hearing, touch, taste, and smell. Each of your five senses has its own special sensor. Each sensor collects information about your surroundings and sends it to the brain. Then your brain uses the information from your senses to help you and understand the world around you. However, children with sensory issues have difficulties in integrating information from different senses like touch, smell, sound, etc. This will overwhelm the children and result in confusing behavior, and hence the reason they show unusual behaviors most of the times. This is what we say children having sensory issues. Wilbarger brushing will help in bringing these sensory issues to a balance and will help reduce those unwanted behaviors. Most of the children show mood swings or behaviors when there is a change in environment. This is one example when a child gets confused while reacting to a new visual sense. Brushing can increase a child's ability to optimize their arousal and activity levels as well as decrease sensory defensiveness. The Wilbarger brushing protocol involves the sensory brush paired with joint compressions, completed in a sequence and according to a schedule. Check with your OT specialist on how to do the Wilbarger brushing and joint compression, and do this few times a day on a regular basis. Information from web says Wilbarger brushing can be used from 2 to 12 years of age. However, check with your occupational therapist before doing the same. Can child have sensory issues and still not be autistic? Experts say sensory processing problems are now considered a symptom of autism because the majority of children and adults on the autism spectrum also have significant sensory issues. However, many children with sensory issues are not on the spectrum. They can also be found in those with ADHD, OCD, and other developmental delays, or with no other diagnosis at all. Along with touch, hearing, taste, smell, and sight, there are some internal senses of body awareness, proprioception, and movement, vestibular. The vestibular sense contributes to our ability to maintain balance and body posture. Sensory system that contributes to balance and the sense of spatial orientation. Example, when you have an ear infection or any body condition, when you sometimes might feel like your entire body was spinning in space and be unable to walk. The proprioceptive sense, the sense of the position of parts of the body relative to other neighboring parts of the body, focuses on the body's cognitive awareness of movement. Example, when stepping onto an elevator, you take a control on when you keep your first step. When the brain can't synthesize all this information coming in simultaneously from all these 7 senses, it's like a traffic jam in your head, with conflicting signals quickly coming from all directions, so that your child don't know how to make sense of it all. This is where the child reacts and shows unusual behaviors. When you can do Wilbarger brushing and joint compression. You can do it in the morning after the child wakes up. You can do it in the car. You can do it before taking your child to a different environment. You can do it before the child goes to sleep. This YouTube channel, Speech Without Stress Kids, will be renamed to Aaron Foundation soon, and the new channel will have the actual role plays with the child and adult for easier understanding for the parents. Keep watching and follow us on YouTube. Thank you. If you find the video useful, click on the like button, subscribe, and share.